different show. Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today has been on the show before, and she is a very, very popular guest. We get so many people that write us in advance with questions for her because she is not only a wonderful plant-based doctor, but she is also board certified in dermatology and now lifestyle medicine. She has a new podcast now, which I'm sure she's going to tell you about. Please welcome Dr. Jessica Krant. It's great to see you again.
Thank you so much, Chef AJ. I'm so excited to be here as always. I always anticipate my chance to talk to you because I feel like, honestly, I'm hanging out with a girlfriend and we're just catching up. So it's always so much fun.
That's great. So tell us, before we get into the questions, which we will get into, tell us about your new podcast.
Well, I decided to take the adventurous opportunity and launch a new podcast. And it is called Save Your Own Skin. And it is the reason that it's called Save Your Own Skin is that it's a double meaning. I do mean we're going to talk about dermatology and how to save your own skin from the inside out with healthy lifestyle and healthy nutrition. But also I am going to talk about the latest and greatest in skincare technology and new skincare science and some of the updates on procedures just for fun, the things that we'll do just optionally in addition to our healthy lifestyles. But really, Save Your Own Skin is also an exploration of my journey into becoming a certified life coach. I'm a certified life coach now, and I've been helping my clients not only take care of their physical health and get healthy physical habits for living, but also to learn how to break out of the ruts in their lives that hold them back at work and in relationships and friendships and family, to really get the lives they want, so that all that psychic energy that gets drained by being stuck in a place that doesn't give you energy and doesn't make you happy. Learn how to fix all those things yourself in your own life, so that all that energy that you can take can be used we can use it to take care of ourselves. And then it's just I don't want to say vicious cycle, a positive cycle of taking better care of ourselves and honoring ourselves better, which makes us feel more worthy and more worthwhile and have more self-confidence in going after the things we want and our big dreams in life. And that also renews our energy to take care of ourselves and honor ourselves. So it's been really so much fun. I just have a couple of little short introductory episodes out now on any podcast platform. And again, it's called Save Your Own Skin. Like, no one's going to come do it for you. You have to save your own skin, that old phrase. And that's really what it's about. And as I keep teasing you, when I start interviewing my expert guests and having guests on the show, Chef AJ, I hope that you will be one of them.
Absolutely. That's
one of the first. So watch out.
What an honor. I've listened to the few episodes so far. I like what I hear, and we have the link to it in the show notes. Show notes are what you see below this video on YouTube. If you're watching on Facebook, you'll have to go over to YouTube to see what we're talking about. So you're board certified in lifestyle medicine, and I'm curious how you incorporate that with dermatology, like the 6 pillars of lifestyle medicine, for example. How does that pertain specifically to skin?
Well, lifestyle medicine is a whole field of medicine. It's pretty new, so people may not realize it's actually a true medical field. And there is an American Board of Lifestyle Medicine that I became certified by doing a lot of required criteria and passing a board exam in 2018. And lifestyle medicine is a field of medicine that focuses on 6 pillars of proven evidence-based healthy lifestyle practices that make our health journey smoother, more self-directed, and less reliant on medications and needing traditional therapies. The 6 pillars are nutrition, which is we consider to be food as medicine. Food is medicine. It's either helping us be healthier or it's hurting us. No matter what we eat, it's either helping us or it's hurting us. And that's always a guideline to keep in mind. The second pillar of lifestyle medicine is physical activity and exercise. And of course, we know that that impacts our overall health in every way, but it also impacts our skin. The third pillar is sleep. I've always said to any reporter who asks me, Dr. Krant, what is your number one beauty tip? My number one beauty tip is always quality sleep, because sleep controls everything, including the health of our skin, which I'll definitely can go into in more detail at any time. The fourth pillar is stress management, mindfulness, our internal axis and our internal guidance in reducing our own stress levels and learning how to manage our stress, because stress actually damages us when it's chronic, when it's ongoing, long-lasting stress. It breaks down the tissues in our body, it breaks down the health of our brain, and it also damages our skin. The fifth pillar is the outward axis, I say, between ourselves and other people. Relationships, our intimate relationships, our family relationships, and our relationships with friends and colleagues and social networks. The Harvard Health Study came out with a shocking statement just a couple of years ago, when they found out that over decades of research, the one category of evidence that was directly linked to longevity the most was actually people having a healthy social network. People who became more isolated and were more alone later in life did not tend to live as long as people with a healthy social network and healthy relationships. And that was really amazing to read. The sixth pillar in lifestyle medicine is minimizing toxic substances that are optional, really. So in terms of overall health, the basic ones are considered to be cigarette smoking and even alcohol, which is really a poison. And evidence now shows, over a global collection of data over many years, with all of the studies about drinking alcohol, that any amount of alcohol more than 0 actually increases our risk of mortality from all causes. They call it all-cause mortality. So all of the smaller studies that would show that 1 glass of wine is good for our heart, or 2 glasses of alcohol a day were safe for men, turn out to be just too narrowly based, and we're missing the long-term consequences in other spheres. So alcohol and smoking. And for dermatology, I also include in that sixth pillar environmental pollution, how it affects our skin, and potentially toxins in our skincare products and things like that. All of those substances that we don't need in our lives and not only don't contribute to our health, but potentially harm us. So those are the 6 pillars of lifestyle medicine in general. Doctors in different specialties are able to apply each of those 6 pillars to kidney health or to brain health. I tend to focus on skin health because I'm a dermatologist, but I'm fascinated by the evidence for these 6 pillars in all categories of our health. It's just been an amazing journey for me to learn how much our lifestyle choices every day absolutely control our health outcomes.
Yeah, thank you. Well, here's a question from Jyoti. I hope, I apologize if I don't know that. Is veganism or compassion to animals one of the pillars of lifestyle medicine? It isn't, but wouldn't it be nice if it was the 7th?
Well, it's interesting. That's a great question, because lifestyle medicine is focused on the health of humans, but the leaders of the lifestyle medicine movement and most of the leaders in this arena and most of the researchers over many decades of learning about the health of plant-based eating and plant-based diet turn out to have proven basically that a whole food, highly varied, plant-based diet that does not rely on any or completely avoids animal products is the healthiest diet. So I think, just terminologically, speaking of vocabulary, when we say plant-based, we are referring to people who are choosing to eat this way for human health reasons. But it also is so easy to adopt, and really people's values align in this world, because it also supports protecting animals and not using animals for research. And it's a similar overlapping sphere of values. So the vegan world, in terms of what they say, I guess they say ethical vegans, meaning the people who are vegan because primarily of protecting animals, has a huge overlap with the people who are plant-based for their own personal health. It's not really a pillar of the lifestyle medicine prescription, but it is part of that world in addition. By the way, it also, all of these choices for being plant-based and less reliance on commercial agriculture and big dairy and big, cattle agriculture also is good for the environment. So we have human health, we have animal protection and animal health and animal respect, and we have respect and protection and fixing the environment. So for me, it was just a no-brainer when I began to learn more about the science behind lifestyle medicine, that it's just everything that I believe in, and it makes it very easy to support and go out into the world to teach everybody about.
Nice. Well, I appreciate that you're so passionate about it. One of the things you mentioned is avoiding toxins. And one of the questions we get a lot in general, and specifically when you, a dermatologist, comes on, is the debate about sunscreen, because people want to avoid it because they say it's chemicals. But I got to tell you, if you live in the desert when it's 122 and some of the strongest sun, I don't think it's safe to go outside without it.
Yeah, sunscreen, it is a controversial topic, but it shouldn't be as controversial as it is right now. There's no doubt right now that sunscreen wearing has saved lives and reduced cancer. And also, by the way, it helps to reduce skin aging. Now, we want to minimize unnecessary and toxic chemicals in all of our creams and products that we put on ourselves. And the world of personal care products is really full of unnecessary chemicals. I think we're really on the cusp of a movement to learn more about it, pay more attention, and try to do better. But still, there has been no proof of a grown human being harmed by commercially available sunscreen on their own actual live human body where they have intact, healthy skin. But it is proven to save lives and save the morbidity, and the disfigurement of skin cancer and skin cancer surgery. So I advocate avoiding strong direct sun midday. Of course, don't get sunburned. Wear sun protective clothing as much as possible, which, by the way, is much cuter these days. There are a lot of companies making some really cute styles. A big hat that puts your face and your chest in shade. Big sunglasses to protect not only the retinas of your eyes and your lenses, because too much sun exposure can actually lead to cataracts and damage to your retinas.
Yeah, tell me about it. Hello. Oh
yeah,
my God. That's what he said. The most important thing when I was just diagnosed with early cataracts, and luckily I had a Japanese ophthalmologist. I said, "What can I do? I want to outlive this cataract." He says, "Eat lots of greens and wear sunglasses, even when it's overcast."
Right. People don't, it's been so long since a lot of us have had family members involved personally in war. America has been involved in many wars, but there used to be the famous desert blindness that we all kind of knew about and was part of our regular vocabulary. And desert blindness was so much sun reflecting off of the sand in soldiers that it was actually causing cataracts and causing blindness and damage to retinas. So not only do big sunglasses protect the actual eyeball and our vision, but they also protect skin cancer risk around the eye and aging around the eye. All those eye bags and thin skin and dark circles under the eyes that we want to go to the dermatologist to fix could be greatly reduced if we were wearing big sunglasses all the time from the time we were young. So sun protective clothing, hats and sunglasses, try to choose the more environmentally and chemically, safe sunscreens if possible. There are always lists coming out from the Environmental Working Group or other organizations take them with a grain of salt because they have their own agenda too, and it's all new research. So we're still collecting evidence about what's actually harmful to grown live humans, but do the best you can. Benzene just came out. They just found that some sunscreens on the shelf, in the process of making them, ended up with a chemical called benzene in the container. Some didn't. Benzene is a known carcinogen. It does not necessarily mean that if we put that sunscreen on our skin that we are going to cause cancer to ourselves. It doesn't mean that, but it is something we want to watch out for and minimize. So look for the lists of the products that were not shown to contain it, just to be on the safe side. And also keep in mind that all of these concerns apply especially to small children, 6 months and older, who are allowed to wear sunscreen, less so to grown adults. And the reason for that is that infants and young children, the skin quality is different. They have more porous skin that absorbs chemicals more quickly. And based on physics, their small body size means that they have more surface area compared to the volume of their body. So whatever you put on their skin can have a higher concentration inside their bodies than if you put something on the skin of an adult, because we have a lower surface to volume ratio. So it does matter more for kids. So do pay more attention for your kids, but don't let anybody go out without sun protection. Sunburn is not worth it. And I think that's all I wanted to mention. There might have been something else, but I'll come back to it.
Great. Just want to read. Kathy wrote, Dr. Krant is my favorite guest. Well, she's certainly one of my favorites. You know, I know people that are afraid to put sunscreen on, but they're not afraid to put crap food in their mouth. Go figure.
Oh, yeah. Not only that, worry so much about sunscreen when you're just talking about your face, but put weird things on your body because you read it on the internet that it was going to make your skin smoother. So besides the fact that when we talk about sunscreen, we're talking about two different things. We're talking about the sunscreen chemicals themselves, the sunscreen ingredient, the thing that's blocking the sun, which come in physical or chemical categories. The physical are the titanium dioxide and the zinc oxide. And the chemical ones are all the other ones, the oxybenzone, avobenzone, octinoxate, all of those. Those are the ones that are potentially more questionable. But it turns out that the titanium dioxide and the zinc oxide, we think they work by being a physical barrier and reflecting the light, but it turns out it's just not that cut and dried. And besides those, we always neglect to talk about all of the other ingredients that are in these bottles and in these tubes. Those are all chemicals too. So it's not that easy to track the risk, and it's just easiest to do safe behavior. I know what I wanted to say earlier, which was sunscreen does not belong on infants 6 months and younger. Babies 6 months and younger should not be going out in direct sun. They should be in shade and have protective clothing on, just to be clear.
That's great. You know, how resilient is the skin, Dr. Krant, from abuse? Because if you look at some of my older YouTubes, because I really never wore sunscreen. I've got burned multiple times. And it wasn't until they read me the Riot Act, like every doctor here, doesn't matter what their specialty, like they see a tan on you and they're like, because they've seen it, they've worked here and they see the rates of cancer. So I really haven't had any sun on my face for 2.5 years. And I think my skin has actually improved. So is there hope for the damage that sometimes occurs, whether it's through smoking or sun, if people stop the assault?
The analogy I use is smoking. As we learned a couple of decades ago, when we started to learn that smoking was bad for us, when you quit smoking cigarettes, your lungs immediately begin to heal themselves. And I forgot the exact timelines, but it's something like 2 weeks after you've had your last cigarette, your lungs are healthier. 6 months later, they're healthier. And many, many years later, your lungs look like somebody who never smoked. I don't think that your cancer risk goes all the way back down to zero, but our skin and our lungs and our organs, we are amazing biological machines trying to live and be healthy and survive. And like I said about the food, we're either doing things to our bodies that help support that health and help the body do what it wants to do, which is keep us healthy and survive, or we are doing things that damage us. And, I have to say, especially in American culture, we do so many things every day that damage us. Our poor sleep, our terrible diets, our lack of exercise, working too hard, living with so much stress. All of those things are terrible for us, and we still manage to survive. If we just take away all of those negative pressures and feed ourselves widely varied, rainbow colored, whole grain, including healthy, whole food, plant-based diet with lots of fresh, juicy fruits, and reduce our stress and learn how to get the barriers and obstacles in our lives out of our way, and learn how to set boundaries so that we don't have stress with other people because everybody understands what makes us comfortable and what works for our relationships. If we can do all those things, I think our skin is just like the rest of us. It will make itself healthier if we let it.
It's hard to believe that in this day and age, people still smoke and now vape. I actually know a plastic surgeon that will not operate on, because we're talking cosmetic surgeries, like elective, not that she won't operate on anyone that smokes.
Yeah. I mean, not only I understand that philosophically, but smoking does literally prevent wound healing physically. So there are cases of smokers who had surgeries where the wound would not seal closed and would open and become infected and terrible. So I do not blame her at all. And she would, she's trying to help people. She wants them to also be helping themselves at the same time.
Yeah. Great. So would you like to jump into some of the questions? Guys, we always do the previously submitted ones first. So get on my mailing list. It's chefaj.com. We don't spam you. We just send out the guest list in advance, and then you write us back. And then if there's time, we'll get to the ones in the chat. Okay. So the first question is from Kate, and it's about, I never say this right, but it's Trentoin. I know the medication with the Retin-A. She says, is it okay to use every day for the rest of your life? And is it okay to apply on wet skin? Because when I apply it to dry skin, I can't get it to spread.
Tretinoin is the generic term for the vitamin A. The original vitamin A cream, that the original brand name was Retin-A. So it's famous under the name Retin-A. Is it safe to use for decade after decade? We don't have any evidence that it's not. It has so many benefits for skin health and reducing aging, reducing wrinkles. It actually is a medication that helps treat acne. And there is some evidence that it may reduce the risk of future skin cancers by normalizing the skin cells and not allowing them to develop if they are precancerous. But I don't know of any evidence that shows it's dangerous to use it indefinitely. There is some question about whether it has a little bit of an unusual effect on skin and causing an appearance of a little bit thinner skin later in life, sort of a translucency of skin, but it's hard to know whether that would have happened without it. So I don't know of any danger to it, especially if it's just used on your face. As I said, that small surface area compared to your whole body, it's not absorbing a lot in any way that could hurt you. It's also a vitamin A. So in some ways, it's probably good for us. But those are my thoughts about it. I forgot what the second part of the question was.
She said,
how to put it on wet face.
Use it on wet skin out of the shower, because she says when she applies it dry, she can't get it to spread.
Yes. First of all, don't use a lot. A lot can make you get very irritated, red and peely, and potentially even perpetuate some acne breakouts. So you do want to use a small amount. Putting it on wet skin probably allows it to spread, but it also increases the absorption rate. And increasing the absorption rate increases the ratio of side effects you don't want compared to the benefits you do.
Wait, so that's if you put it on wet or dry?
If you put it on wet skin, you will get more irritation and potentially more breakout because it actually works, it gets absorbed faster and it works more quickly. So the signal is increased. So if you want that benefit and you tolerate it, it is fine to put it on damp skin, but if it's very irritating for you, very drying, makes you peely, then you want to back off of putting it on wet skin. Put it on skin that has been moisturized and then wait. And then let your skin heal and close off and seal back up after being washed. Because when we first wash our skin, first of all, we wash away our natural protective oils that are healthy and are there protecting us. We wash away the healthy balance of our skin microbiome, and we wash away what we call the acid mantle, which is the pH protector of our healthy barrier. So putting a chemical right into that environment can be a little harsh. If we let our skin recover from washing and put a moisturizer there, if needed, to help seal up that barrier, and then later put a little bit of the tretinoin on the Retin-A, it slows down the absorption of the tretinoin and allows us to get the benefits with much less of the harsh side effects.
Great, thank you. The next question is from Nita. She says, have you ever heard of using Estrace cream off-label for fine lines and wrinkles? And is it safe?
I've heard of some people potentially talking about it or trying it, but as that is extremely off-label, I really don't think that I can promote it or condone it in this venue. I have heard some gynecologists say not to do that, and I don't remember the reasons why. So that's about as much as I can answer on that one right now.
Great, thank you. Okay, from Susan. What can I do to keep corns at the bottom of my foot from coming back? I have never had that before.
Corns are basically calluses. Let me just clarify. Some people have true corns, which are truly little small calluses that form because there's a bone under your skin that is hitting the ground or hitting your shoe more often than it used to. And your skin is creating a callus there as a protective cushion, as a pillow. So if you keep scraping away a corn that is a biological cushion, you're just going to thin the skin over the bone and eventually may have an ulcer there. So if you really have a bone that is, as we get older, our feet kind of bend a little bit. And if you have a bone that's pushing out and creating a corn, that's a sign that the bone alignment may need to be addressed by an orthopedic surgery, not necessarily needing surgery, but an orthopedic foot doctor or maybe a podiatrist. However, a lot of people think they have corns on their feet, and what they actually have are called plantar warts. They are actually viral infections, and they are warts. And that particular type of the wart virus likes to go only to the bottom of the foot, and it makes these very stubborn, deep wart infections. Those may form on the ball of the foot or under a toe where a corn might form, but they can actually form anywhere. So they're common in the heel, the ball of the foot, under the toes. They're very, very stubborn and really no fun to deal with. So if you think you might have one of those, I would get on it immediately, at least with over-the-counter treatments, and keep going because it can take 6 months, or go see your podiatrist or maybe your dermatologist to get some help. So real corns, if you keep scraping them off, but you haven't changed the shape of your foot, you can't stop them from coming back.
Wow, thank you. This is from Melissa. What are the consequences for someone who has dermatitis herpetiformis but eats gluten anyway?
From what I understand, and I am not an expert in this category, but true proven dermatitis herpetiformis is the skin sign of real true celiac disease, which is a GI tract, a gastrointestinal tract autoimmune condition. And with celiac, you, the people who have true celiac disease, are truly allergic to wheat gluten. And when you eat the wheat gluten, or the gluten that is found in a lot of foods in the standard American diet, your body recognizes it as an enemy, as a foreign allergen. And that means it sends your immune system to attack it. And the inflammation that gets triggered by that causes the rash, dermatitis herpetiformis, because your skin also gets attacked in a side attack. And this is what I like to talk about in some of my lectures and some of my webinars and things I give. I talk about the direct relationship. I think I did with you too, Dr. Chef AJ, Dr. Chef
I love
AJ.
that, Dr. Chef AJ.
I know, I love it, Dr. Chef AJ. We talked about the connection between gut health and skin health. And celiac is one of the perfect examples of showing how the immune systems in the gut and the skin are connected. When the immune system attacks your own gut, you attack your own gut, your own skin also gets attacked. So when you have dermatitis herpetiformis and you keep eating wheat, you're actually attacking your own gut without maybe realizing it. And you can really break down your GI tract and really damage it permanently. And one of the reasons that it's a problem long before you may realize is that damaged GI tract tissue doesn't absorb nutrients properly. And you can really get a dangerous malabsorption syndrome or a nutrient deficiency that can affect your other organs and your energy level, your brain, and all of these downstream consequences that are not just about whether or not you have a little rash that's sometimes itchy.
Nice, thank you. Janet has 2 questions for Dr. Krant, if possible. Number 1, are radio frequency treatments okay health-wise?
Any of those procedures, radio frequency, micro needling with radio frequency, and anything involving energy, involving needles, involving lasers, they all are potentially damaging and dangerous in the wrong hands with the wrong settings. So you really can physically get hurt and you can become permanently scarred if they're done wrong. From what I understand, done in appropriately approved areas by somebody who knows what they're doing and is properly trained, the radio frequency energy itself, we don't have any evidence that it's harmful in any internal way. So I think that if done properly, it's not dangerous to our health overall, but it's still a risk to be undertaken carefully.
Great. And her second question is, does facial PRP work for those over 65? And maybe you can explain what that is in case people aren't familiar.
PRP is platelet-rich plasma, and it means that your blood is drawn and they spin the cells in a test tube and they pull out just the plasma that has some growth factors broken down into it by the spinning, and they inject it in your scalp for hair growth, in your face, theoretically for young cell growth. And it's also used in joints and, in other areas of the body. It's really a new field, and some research shows that it has great promise and other shows that it really does nothing at all. So I am still on the fence about whether PRP, the material, the platelet-rich plasma, does something special. It's talking externally for scalp or face, or whether it's possible that just injecting the tissues alone, which is creating little needle wounds, is not triggering a wound healing benefit that brings growth factors to the area that is causing some of the improvement itself. I recently heard a dermatologist that I really respect basically imply that facial PRP, it doesn't really do what it promises, especially in certain areas like around the eyes. So I am on the fence, and I don't give it a big, huge thumbs up, but I also don't say that it's not doing anything yet. I am holding my judgment in reserve.
Right. But it does do things for orthopedic concerns often, right? I've heard Dr. Stefan Esser talk about it. He's a plant-based doctor.
Some people really believe in it and feel that, especially in joints, that it has a true specific effect. But I don't know enough about that to say. I do know that other people have had those treatments and don't feel like it made any difference at all.
Yeah, I was asked to have it for my torn rotator cuff, but I was afraid, not because I didn't think it wouldn't work, or because insurance wouldn't pay, because I heard it's quite painful.
Oh, well, I imagine getting any needle right into a joint is not that comfortable.
I mean, I'm still afraid to go to the dentist, and I'm 61, so I'm not looking forward to something like that. Okay, great. So we have one more previously submitted question, then we can go on to the chat. This is from Annie. Please ask about treating fingernail fungus, how to best treat the present infection. Is it possible without taking oral medication? What causes it and how to prevent future infections? I'm a 67-year-old vegan, low SOS, active person. Nothing I have tried seems to be working. I never had this before, and I do not want it again.
Fingernail and toenail fungus, when it is true and proven to actually be fungus, is very, very hard to treat. We can use topical antifungal treatments and also protective behavior like keeping hands out of water and never washing dishes without gloves. Using topicals alone, if they are going to be effective, can take a year and has a small percentage of working. Taking the oral medication isn't even 100%. So the most valuable thing we can do for nail fungus is take a biopsy of, not a biopsy, but a clipping of the nail to show whether or not there's fungus. That's a yes, no test. And then potentially also a culture where the doctor will do a little scraping of the material under the nail and then grow it for 2 months to find out exactly what fungus is growing, because some of them are very resistant to medications and some of them work with certain medications, but not others to get better. So it's really not something you can just guess at and get a slam dunk answer. It's really tough to treat when you know it's fungus. One of the other problems is that there are a lot of nail problems that look like fungus. And when it's not tested, you could be treating yourself for nail fungus for 10 years and not realize that what you have is not nail fungus at all. There are other nail problems like psoriasis, which looks exactly like nail fungus. There's something called 10-nail dystrophy, which is where your nails change on their own and look thick and dry, but it's not actually an infection. There are damage to the nail that comes from nail trauma, and especially manicures and pedicures can cause damage to the nail that disrupts how the nail grows from the root. And it looks like it's thick and growing wrong, but it's not actually an infection. So it's really important to get the tests to prove that there's fungus and potentially even see a nail specialist, because not even all dermatologists are experts in nails. Nails are very tricky and very subtle. And there are some dermatologists that specialize only in hair. There are some that specialize only in nail, because general dermatologists don't always know every trick for nails.
Right. Speaking of nails, I did see one other submitted question here from Louisa asking if things like gel, acrylic, and the new dip powder, are those safe?
They're safe to a point and they're a lot of fun, but they are chemicals.
But they're so pretty.
Look, they're beautiful. They're beautiful.
I only have to do it every 4 weeks, and I can leave the salon and I don't mess it up, and I can wash dishes, and it's made my nails stronger.
Right.
Please tell me. I get the powder.
Okay. I think powder is one of the least bad of all of those. Now, let me say that there have been some cases reported of skin cancer on the fingers of people who put their hands in those little UV lights. And if you do it, for your lifelong and you have strong UV lights and you do it all the time, I can't say there's zero risk. That is ultraviolet radiation. So the forms of these manicures that don't need the light or that don't use UV light anymore, now some of them have LED, they're probably a little bit safer. The old chemicals, a lot of people can become allergic to. So you can get a true allergy of your nails, or you can become allergic to the nail chemicals and get rashes on your face and your eyelids. But the most important thing when getting manicures is reduction of trauma. Don't let them scrape down your nail plate and smooth it too thin because you'll really hurt your nail bed. Don't let what are their names? Not the manicurists. What are their names?
Pedicurist?
Well, is that what they are? The manicurists and pedicurists, they have another name.
Esthetician? I didn't know they had a name.
The people doing your nails, don't let them do anything that's actually hurting you. If it's hurting you, something's wrong. If they're pushing the cuticle back too hard and it hurts, they're damaging the seal between the cuticle and your nail. And that seal is important to keep moisture out and keep infection out. Don't let them cut your cuticles off. No cutting off the cuticle with the clipper. They can soften it and gently push it back and carefully trim some loose edges, but no cutting off the cuticles. That's a huge risk for infection and problems. And no cleaning under the nail too harshly. So no scraping or cutting too deep. So if everything is gentle, don't shave your legs right before you go get a pedicure and put your legs in those hot water buckets, get infections in your legs. Just keep the open access areas to the inside of your body sealed and closed, and it's probably okay.
Okay. So
how'd you like that fun long list of all the problems you can get at a salon?
I know, but it's like, it's so hard to want to be beautiful and safe at the same time sometimes,
Yeah. I spent 8 months getting those beautiful nails done, and then I just got too lazy to keep it up.
Yeah. Well, first of all, this is something very new to me. I never even heard of it. And I didn't get a manicure or pedicure for the first year of COVID. So anyway, but
you know what, I really stopped, and I'll tell my personal story. I stopped because my nails were hurting because the woman was doing them manually and she was kind of smoothing out my nail every time with a nail file. And my nail plates got thinned out so much that it was painful to have these nails on them. And so I stopped going and had them taken off. And it took my nails 12 months to recover. It took my nails a year to stop peeling and being thin and damaged. So careful what you do because nails take a long time to recover.
Okay, thank you. So we'll get to the chat now, as many as Dr. Krant has time for. And this is from Monarch. How about wearing full covering clothing when outside instead of t-shirt or shorts? Would that be better than sunscreen? And how would we absorb vitamin D if we're wearing sunscreen?
Don't get yourself heat stroke by wearing too much clothing. But if you can get a light, breezy fabric that is a sun protective fabric and you don't mind and you enjoy it, great. That's wonderful. Then you're not putting sunscreen on. But remember that a lot of times what happens is you can go out with all those clothes on and it is so hot and you feel like you have to take off some layers. And then you didn't bring your sunscreen and you don't know what to do. There's not as much of an umbrella as you thought there would be. Or like me, you sit under what you think is an umbrella. You can see the sun through it. And you don't realize that that means the sun can see you. And you sit out there all day under that kind of woven umbrella and get completely fried like I did once. So sun protective clothing is great. And the rest of the question was about
how do you absorb vitamin D if you're wearing
vitamin D? Right. Vitamin D gets made inside your skin when ultraviolet radiation hits it. So it's a trade-off. I love people being active outdoors, and I don't want people to have skin cancer. And I don't want you to have any more aging from the sun than you want. But of course, I don't mind people getting outdoors. The way around the vitamin D question is to take a vitamin D supplement. And, I only advocate for completely plant-based people. If you're really good at it and you know what you're doing, the only one you have to take is B12. But I also advocate everybody taking vitamin D. And I take 5,000 units of vitamin D every day, 5,000 IU, international units. And that is because the low end of normal for the vitamin D range is considered to be 30. But I didn't know that for years. I was living at 19 and 20. And now we know that even 30 isn't really good for all of the needs we have for vitamin D. We want to aim to be between 50 and 70. It's not even possible to get up to 50 or 70 with the way we live in our industrial society. So no matter what, we should be taking supplements, even if we are active outdoors. By the way, go see your dermatologist for an annual skin cancer check, just to make sure that when you are active, that there's not something brewing that you don't recognize or that you can't see. So that's how we manage it. Supplement, whole food, plant-based diet full of antioxidants that naturally reduce your risk from the sun from the inside out, sun protective clothing, and just monitoring everything.
I just had my annual skin check and I didn't realize you are naked for it. It was kind of interesting because they always have what do they call, like the residence learning, and it's bad enough having to be naked in front of one person, but like when there's a whole bunch of other ones watching, it's like, whoa, didn't sign up for that.
You're brave. In my private office, there are not residents, and I do have my patients keep their underwear on, and then I check around it. So I go for modesty.
I don't wear underwear, and I didn't know I was getting a skin check, but it's all right. I figured he's seen it before. So, but it's just, it's not so much the doctor, it's like the onlookers, you know,
the audience.
But it's a teaching place, but it's all right. They need to learn. I mean,
it's all right.
Yeah.
And they're doctors.
They've seen it before, you know, right? Anyway, it's just always so funny to me, like how whenever you see a doctor, they knock on the door and I'm like, it's your place. You could just come in, you know. I just find that so funny that they all do that. But anyway, so here's a great question from Kelly, but I'm wondering if you're going to answer it, maybe come back another time and really answer it, which is, do you have a list of suggested makeup and skincare products? I'd love to know. I'm due for new makeup. Makeup is hard for me to answer, but for skincare, I recommend 2 vegan brands. And I know you didn't ask me, but I'll just say it: Body Deli and Kaylin Harwell, both which have given me discount codes.
Yes, I'm going to go with your answer for now. I don't have a list of makeup brands and skincare brands. I don't really want to be specific in terms of brands because I'm trying to kind of stay unbiased, and I like to talk about ingredients to watch out for or general concepts right now. But maybe someday you can get me to come back and talk about some. I actually I just formed a relationship with one skincare brand that's actually started this week, but I'm not going to mention it right now.
Maybe you'll have your own brand named after you.
Well, that's a dream. One day I would love to have my own vegan, cruelty-free, sensitive skin, amazing skincare brand someday, of course.
Yeah, that would be great. And I'll be your first customer. So here's a question from Janie. Is glycolic a safe product to use on the face?
A low percentage of glycolic acid, like 10%, used in moderation from a reputable company, is safe to use a few times a week. I don't even know if I could say it's safe to use every single day. It's a chemical peel that peels off the outer layer of your skin. So just be cautious, try it once a week at first, make sure that you don't overdo it. And I wouldn't go above 10% for home use for trying it out on your own.
Great, thank you. Okay, let's see what else we have in the chat. Karen says some cosmetics use physical sunscreen only. Does that work? And that's a good question because, you know, I see sometimes like on maybe primers or foundation, like it'll say SPF 15, SPF 30. If you're wearing that as your makeup, is it enough or do you still need a sunscreen?
SPF 30 is the minimum I would recommend. So if it does say 15, I don't think it's really enough. But the bigger issue is that what's on the label is what they find when they put an extremely thick layer on in the lab. That's how much protection whatever they're protecting and testing in the lab is getting. It's very rare that we choose to and do put as much on our own skin. So no matter what, we can generally assume that what we get on our skin is less SPF than what it says on the label. So that's why I always recommend that we cheat upwards. If you want to end up at 30, don't use something that's less than 50. If you really want SPF 30 and you have an SPF 30 bottle, assume that you have to put so much on that you cannot see your own skin. Because if you can see your skin, that means the sun can also see your skin, and it's probably getting through to some degree. The other thing to keep in mind is that those SPF numbers reflect only ultraviolet B radiation protection and not ultraviolet A rays. And the ultraviolet A rays are the ones that penetrate deeper and they cause more aging. So you can't necessarily go by just the SPF number. The other part of the question was the physical sunscreens, the zinc oxide and the titanium dioxide. Those have a broader range of UVA protection. So going for the broad spectrum, UVA to UVB, zinc oxide has the broadest spectrum. So that's one of the best ingredients. It also is one of the most opaque. And it is hard to find a product that is completely transparent, that really has the full protection of zinc. So that's why people use the chemical sunscreens, because they tend to be what we call more cosmetically elegant. They rub in, they're pretty light, they're transparent, they tend to not need to be tinted, so they don't necessarily get on our clothing. I want to mention one other one too, the new kid on the block, which is iron oxides. Iron oxides are part of the new titanium dioxide, zinc oxide, and iron oxides. Iron oxides are the new kid on the block that we now know help to block visible light, blue light rays, the visible light rays, and block heat a little bit, because it turns out that melasma, one of the deep pigment issues that we can get in our skin, is created not only from UV exposure, but also from visible light, even indoor lights and heat. So iron oxide actually blocks the visible light rays which means the light we can see. You know, that all the UVA and UVB, it's all invisible. But the light we see from the sun is the visible light. And if we don't block that, we still get damage. So iron oxides are now included in a lot of modern sunscreens. And the reason I'm mentioning them is that iron oxide is rust. And you'll notice that there are no iron oxide containing sunscreens that are not tinted. They have to be tinted because the iron oxide is a little bit brownish.
Wow, thank you. Gloria says, is there something you can think of that is natural that you can use to treat scalp psoriasis?
True psoriasis is an overproduction of cells. That is an autoimmune condition. So, one quote unquote natural treatment for it, the old fashioned treatment was and still is coal tar. Coal tar is natural. It is from dinosaurs, so it is not vegan, but that's natural. T-gel shampoo is coal tar shampoo, and there are other coal tar shampoo brands. Other than that, you might be dissolving some of the flakes with oils that you can rub into your scalp.
Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce
I'm
you
so sorry.
to
What is
amazing people
happening?
like you who are doing great
Another
things in
thing
the
is
world that I think
playing.
you should know
What do
about.
I
And my guest today
I
is
don't
doing
know.
great.
Oh my
all the
God,
way
help.
from India.
Charles, can you help?
Shaheen,
Another
and
video
he's
start. I
It's
just
so nice to meet
pre-recorded
you.
a show, and I think it just
Thank you,
help.
Chef AJ.
Charles, please help.
I thought I'll
Oh my
start
God,
with
we're
the
playing
slide.
two shows at once.
That would be
That's
easy.
okay. We can
Charles,
learn.
help
And I'll
me.
not miss out
We
anything.
can learn from the other one.
Charles,
So I just gave this name, My Journey from an
I'm so
Unhealthy
sorry.
Eater to an Advocate
Something's
of
playing and I
Lifestyle
don't know
Medicine
where
as
to
the
stop
topic,
it.
of today. The reason being, for me to get into lifestyle medicine,
My computer, this is
through
why I need a new
experiences,
computer. The
our
thing
own
is circling.
experiences with lifestyle
Guys, I'm
disease
so
reversal.
sorry.
So I
This is
thought
just,
I'll take you all of
I'm trying to
through
quit it,
that.
but this.
Sounds great.
Yes, actually, I'm
Okay,
just
sorry, Dr. Krant.
Oh, no worries.
I need a new computer. I tried.
So there's a short introduction about
This is
me.
why I
I'm
have to
Dr.
have a new
Regina
computer.
Shaheen. I'm from
Please
India,
do
basically
something.
from Bangalore.
You're not doing
I
it, though.
co-founded an organization
Quit,
called
quit,
Invest
quit.
on
It's all right. It's all right.
into
Oh
lifestyle
my God.
disease management.
Wait,
I'm also currently
Just
holding
cancel,
the
shut
position of
down.
Director of Aligned Advocacy at Indian Society of Lifestyle Medicine. which is the counterpart, or it is the sister organization of ACLR.
Oh my God, I'm so
American
embarrassed.
College of
Not at all.
So I can't stop it.
Not at all.
I need a new, please, can you please
I'm,
get me a new
I'm practicing
computer?
lifestyle medicine from 2014.
Just, I don't care if I lose the other
Certified
person's
This one,
with
podcast.
IBM,
you're gonna shut
International
yourself
Board
up.
of Lifestyle
You don't wanna-
Medicine in 2020.
Just shut this off.
And I'm a vegan.
Well, you're getting
you know,
a
last few years
preview of another.
touching any animal products.
Would
I'm
you
a nature
stop
lover,
doing
Well, you're-
love science, enjoy fashion.
It's no
that?
problem.
I don't do well
I
with
love
stress,
exploring places.
especially
okay.
when I don't know when it
Nature
comes
and
from.
environment.
This is what happens when you
Large
take a
extent.
week
And
off.
to
How
personal
do I
friend,
stop it?
Oh, this is open right
staying
here,
with my
probably.
family, my
But
husband,
how do I stop
my
it?
12-year-old daughter in Bangalore.
Oh
She
my
is
God,
also a
Dr.
vegan,
Krant, I don't know what
and
to
she is the
do.
reason
Oh,
that
it's no big deal. You know, this is, we've got, I think we've gotten away with 8.
actually
This is our 8th show with no problems.
happened.
I can't turn it off because I don't know where it is. I recorded a show before here with a doctor in India.
Regular medical professionals
Is that
for
what's
lifestyle.
playing?
Yes, but I don't
practitioners.
know where it is to
So
stop
it
it.
was in 2010.
And I guess it took an
12
hour to
timeframe,
download,
my
and then when it
husband
Right.
started
Right.
playing.
Oh,
I was
well, that's
pregnant with
right
my
here.
child,
No, that's not it.
and
It could be along the bottom. It could show you what's active.
You use that one. You're not helping, though.
Because if you came to
I wonder if
take
that
care
means
of
we're
me
just
during
supposed to
that
end the
time.
show.
In India, like,
Oh,
a lot of
this is-
Well,
things happen.
Maybe we
So
can
on the
edit
way
this
back,
out.
He was like
I
having
can't do it
some
if you're
kind
gonna
of
do this.
panic
You'll
attack.
yourself.
Can you
And,
please help
you know,
me?
He couldn't drive further, and then he had been taken to hospital. He was in
I don't know
his
what to
early
do
30s
here.
that
Maybe we
time.
should just end the
Listen,
show.
when
whatever you want, no problem. I'm fine.
I
came to
mean,
know
I
that
hear it,
he's,
but I don't see it.
admitted in
I wish I were there to help you.
He has shot up, and they
Okay, I'm
kind
gonna
of-
let you,
the
please
doctors
help
kind
me.
of,
This is so
felt that there's
embarrassing.
an impending
You
cardiac
have to
event.
get me a new
And we
computer.
kind of went ahead with all the investigations. Investigation has turned out that he has some metabolic diseases set in, but
We're
none
gonna
of the
edit this
cardiac
out.
event, issue was there. But there are a lot of issues with panic attacks. And also he was diagnosed with renal calculi, which was causing hematuria, blood in urine, which kind of got into a level where he was having
It's
kind of
not
getting
on
into an
anything
anemic
that I
stage.
have
actually.
open,
So
Charles.
we
Well, where do you
went
think it's
and met
I don't know where it's coming from.
urologist, and
That's what
finally
we're
we
trying to
had to
find
undergo
out.
robotic surgery
It's
for the
not
same.
on anything that's on the
And
there.
during the investigation, we found out that he was like
Are you on an Apple?
I'm on a
106
Mac.
feet, but he was
You can,
103 feet with a big tummy.
The Apple
He was,
symbol and
diagnosed with
tab, and it shows you everything that's open.
hypertension, dyslipidemia with a
Are you still there?
I'm still here.
Oh, that's it. Okay.
Okay.
So it was- There you go.
Oh my God.
can edit that out.
Can you edit it out? This was so embarrassing. I'm so sorry, Dr.
No, don't worry about me.
I don't even understand how she started playing in iTunes. Well, you've got a preview of a wonderful doctor from India, and the people watching this later, we will take it right off YouTube, and then we'll put it back up. So
Let me ask you did you want to also stay under an hour?
it's okay because I messed it up. Let's see. Yeah, my next appointment said no problem. Okay, that's what happens. Never take a week off because then you have all this stress. Okay, so let's get to as many questions, and I'll have you back for sure because you're a very popular guest. But this is an interesting question from Saska. How about the light from phones and computers? Does it have a negative effect on the skin?
Evidence shows that it may in some small way. It's very, very new, a very new question. And there's really no proof yet, but it's possible. So in terms of the visible light, and, we know that blue light from computers may damage. There's some question about whether it damages our eyes, but really the biggest issue that we know about is that it can disrupt circadian rhythm. So if there's too much light from screens and indoor lights, it messes up our circadian rhythm and our sleep, which is bad for our overall biological clock and our overall health and our sleep quality. So I would say the effects on sleep, which then can have downstream effects on our skin health and our aging, would be probably more proven than the direct rays from a screen right on our skin yet. But stay tuned because maybe over the next few years, we'll have more proof about whether that's really happening.
It's like we're always inventing more things that are harmful rather than things that are helpful.
I know. I mean, right, like the internet, pros and cons.
Let's see. Okay. All right. yeah, people were giving suggestions on how to fix my computer, but it's like when you're in a crisis, it's just crazy. Okay, because I didn't want to lose the broadcast that we had right now, of course, because the information is gold. Yeah. Okay. So Dina says, I have a natural sunscreen from Costa Rica that offers a 40 SPF. It also has aloe vera gel, avocado oil, carrot seed oil, and non-nano zinc and optifen. What do you think of this one called Cura Sana?
I don't know what Octifen is. It may be a Spanish word for a name of a chemical, one of the sunscreen, the chemical sunscreen ingredients. Zinc oxide is what's probably doing most of the work in that sunscreen. All of those other antioxidant and plant-based ingredients are a little bit helpful too with SPF. In terms of the overall brand or formula, I have no idea if it's good quality or not. But I do believe that if there is zinc in there, it's protective because it's not a US product. I don't have any way to judge whether it's doing what it claims on the label. So use at your own risk.
Right. Great. That's a good point. So Jyoti says, thank you, Dr. Krant, for being vegan. Can you recommend a bug repellent? With the climate warming up, the insects are bugging me.
You know, that's a great question. I don't know of a plant-based bug repellent right now that I could name off the top of my head. I do know that citronella helps to repel bugs in the environment, but in terms of one that we would spray on ourselves, I would have to investigate that.
Yeah, I'm actually going to be having a renowned bug guy on the show, not like an exterminator bug guy, like a guy who studies spiders and insects and how important they are. And so that'll be coming up. I actually met him at Rancho La Puerta. All right. Tammy says, great info. You're speaking my language as a nurse and nutritionist. I've handed out much of the same advice for years. Thank you for sharing. You're very welcome. I saw a question here. Here, Sharon, my friend has melanoma and her doc has her taking a nicotinamide supplement. Should we all?
Oh, Chef AJ, something just cut out. I don't know if you muted. Oh, now I hear you. Okay. So nicotinamide is vitamin B3, if I recall. And there is evidence that nicotinamide, which is not niacin causes the flushing, but nicotinamide is a supplement that you can buy at a vitamin store. There is evidence that it reduces future risk of squamous cell carcinoma, which is a type of skin cancer that is more directly sun-related. Melanoma is about 50% sun and 50% genetic. I don't think it's a bad idea for everybody to take some nicotinamide. It can be a little bit upsetting to the stomach. So I don't know if everybody would choose to try to tolerate it unless you have a high risk history of a lot of skin cancer in your family or in yourself, but it's worth trying. The dose, I believe, if I recall, is 500 milligrams twice a day, but please double check that before you do it. And the other thing to know is, although I said it's not niacin, the synonym for nicotinamide is niacinamide. So nicotinamide and niacinamide are both the supplement. Don't take niacin.
Thank you. And Dina says, how do you, Dr. Krant, take care of your hands and nails? Do you keep them natural?
I have to say mostly out of laziness. I keep them natural. My secret that I finally learned after being an adult for many, many, many years is to keep a nail file nearby all the time because my nails are a little bit thin. And when I get a little torn corner, if I leave it there, my nail will break or peel. But if I gently file it, my nails can actually grow nicely. I have been just doing my own polish when I feel up to it or when there's an event. I just keep it simple. Maybe because I'm lazy or busy or don't want to give $60 to the nail salon across the street.
Really? Oh, that's funny.
But When I had my beautiful French manicured nails like yours, my gel nails, I really loved them. They were beautiful. And I'm thinking about,
pretty, and they're so resilient. They don't break, and you can wash dishes. And
I know I'm thinking about going back and doing some dip nails someday soon. I'll do it, but I won't let them do anything that cuts me or hurts my skin or my cuticles.
Right. Jyoti says people who work at nail salons are usually called nail technicians, manicurists, or nailists, or cosmetic specialists. Good to know.
Thank you. I forgot in the moment what their names were. Yes.
Angela's suggesting for bugs, look into essential oils, because I hear that sometimes they don't like them and it's natural and they'll just kind of go away.
That may be true. And I would also just like to say with essential oils, there are also some essential oils that are really common allergens. So if you're using essential oils, especially if you're heating them and putting them into your environment and you're getting any kind of rashes or eye irritation, don't forget to think about the essential oils. And there are some essential oils that are actually very dangerous for pets and can poison pets. So if you're going to venture into the world of essential oils, please research those and just make sure everything is safe.
Terrific. Fatima says, or Fatima, Dr. Krant, do you recommend microneedling procedures for acne and acne scars?
Microneedling can be effective for acne scarring, for skin that has old acne scars in the right hands. Different skin tones and skin with more tendency to pigment has a higher risk of pigment problems with any physically damaging treatment. Microneedling, because it doesn't contain heat, it's not like a laser with heat, it actually may have less of a risk of discoloring the skin, but there's still a risk. I would not go to any lightly trained person for any procedure like this. It's really an invasive surgical procedure, and I would go to a board certified dermatologist or core aesthetic physician, plastic surgeon, facial plastic surgeon, oculoplastic surgeon to have an invasive procedure on your face. Please don't try to treat active acne breakouts with microneedling. That would cause more trauma and more inflammation, and acne is really an inflammatory condition. So that would not be a good idea if it's active acne.
Great. Do you do something called a subcision? Because I had a scar on my face from being burned, and it was like a deep pocket, and I had a few of those, and it kind of hurt, but eventually it's almost indiscernible now.
Right. Subcision is if there's a scar that's like a little indentation or a cup shape, and we take a needle and we go from the side underneath it, and we cut with the tip of the needle, we cut the tethers that are pulling the skin down. It bleeds a little bit underneath and it detaches the tethers and it allows that skin to raise back up. And if we do that many times, it can actually help to raise up a depressed scar. Depending on the shape of the scar, this can be effective. Some that are sort of a little more gently indented, it works very well. There are deep scars like little holes that are called ice pick. Those are not really possible to fix with subcision. And there are scars that have more side walls with a little boxcar shaped or crater shaped scars that have more straight up and down walls that are also a little more difficult to fix just with subcision alone. Some of these, we do a little subcision and use a little filler, a little cosmetic filler to push under the scar tissue and lift it up temporarily while it heals up a little higher. But everybody's skin and everybody's scar shapes are different. So it always takes an individual consultation, and even may work for a few scars on you, but not some others.
Yeah, but it's amazing that there are these kind of correctives that are fairly minimally invasive procedures that can be effective in some people.
Right. We're so lucky to have some minimally invasive things that can actually help. It's really gratifying to be able to help, and some people it can be so much more difficult to help.
Right. I am going to ask you back for sure. But guys, I just want you to know the best way to get your question answered is just go to chefaj.com, sign up for our list, because we tell you when she's going to be on, and then you write us back. Second best way is to watch on YouTube, because I don't see your comments on Facebook unless I jump screens. And you see what happens when I jump screens. We get voices from India coming on. But I did see this one from Caroline. And I wish I had known to ask you this before I had it done. But is laser hair removal safe?
Laser hair removal can be extremely safe in the right hands with the right trained laser operator who I hope would be a board certified dermatologist, ideally.
Often a nurse, well, I didn't know you then. And I had it done. She was a nurse practitioner that worked under a board certified dermatologist.
Yeah, a lot of physicians have nurses or nurse practitioners working under them. That's a second level option because it's not the doctor themselves. And a lot of those practitioners have a lot of experience and really have a lot of great education and guidance and know what they're doing and understand how to make adjustments for different skin types and different hair types. But you don't really know the background of the laser operators, especially in places that are just laser. You don't know if it's the person's third day or what their experience is. So I just say that going with that baseline credential at least gives you an understanding of how many years they've been exposed to the procedure and, you know, what the level of judgment and understanding of skin biology is. It's not to say that any individual person isn't extremely experienced. It's just hard to know. So go by personal recommendations if possible, but the risk with laser hair removal is when the hair color is close to the skin color. If the hair is a little bit lighter and the skin is darker or the skin is tan, the laser beam cannot easily differentiate between the hair and the skin, and it burns both by accident. What you want is the ideal candidate for easy laser that works very well is a very dark hair with very light skin. That's easy because the laser can easily pick the dark hair root as the target and leave the skin alone. So the darker your natural skin color is, the more careful you have to be in selecting who's going to do the lasering. There are lasers that are safe for darker skin types, but just be cautious, especially with maybe Asian or Middle Eastern skin tones. You can be surprised that your skin may seem like a lighter color to you, but has a high risk of being discolored by these procedures. So just be cautious.
Right. Well, because I wanted to get my arms and legs done, but they saw how tan I was and they said, no, no, no. So I only had it done on areas where the sun didn't shine. And I love it because I hate shaving. But, I find as I get older, I'm not growing hair anywhere anymore. That's pretty normal, right? I hope.
Yeah. For better or worse, some of the changes that happen as we get older, one of the changes is that the hair areas that we grew when we went through puberty that were secondary, they call them like the secondary sex characteristics, underarms and underwear area hair, it does thin out after we start to get a little bit older. I guess, evolutionarily, somehow we just didn't need it as much anymore. I don't know.
Well, that's one of the good things about being in your 60s, that and Medicare, which I'm looking forward to. Rose says, what is the best treatment for broken capillaries on the face?
For real broken capillaries on the face, they may be permanent. And one of the only reliable treatments is really laser treatment.
Nice. And by the way, people don't realize this because I broadcast to like 7 different places. So my chat goes faster than everybody's else and it does disappear after a few minutes. So if you typed your question like more than 15 minutes ago, it's already gone.
Oh, I would just like to say, I think that last answer I gave wins the record for the shortest answer I've ever given on this show. I think it was 1 sentence and then I ended, and it was like, wait, she's not still talking?
Oh, but you're great. You're thorough. You're absolutely thorough. So yeah, anyway, let's see. Susan says, any preferences for which OTC, I guess over-the-counter meds, work for warts on the ball of the foot?
The most reliable over-the-counter medication for warts on the ball of the foot is anything with salicylic acid. And because we walk on that foot, it's the ones that are the liquid drops, they may rub off. So if you do the liquid drops, you may have your dermatologist tell you to seal it up with duct tape or something like that, so the medicine really gets in. But you can also buy these adhesive pads on the internet or at your local store that have salicylic acid embedded in them. Cut a piece that's larger than the visible portion of the wart, stick that on you. And if that's prone to coming off from friction from walking, put a Band-Aid or a piece of tape over that.
Nice. Gloria says, what is the name of the tar stuff you were talking about?
The Neutrogena, the old Neutrogena standard one is called T-Gel, but there are other brands. It's coal tar. Any coal tar shampoo, it will smell like tar. So there's no mistaking it. And the coal tar is an old-fashioned treatment for psoriasis. They used to put people in coal tar baths in hospitals and then give them treatment with ultraviolet light, and that would cure psoriasis in the old days. We don't have that inpatient treatment anymore. But before you use excessive amounts of tar all over you for your own psoriasis, talk to your dermatologist, because tar is also considered potentially dangerous to put on our skin too much. In commercially available shampoos for your scalp, it's totally safe, but don't go to the La Brea tar pits and jump in without talking to your doctor.
Well, here's an interesting comment from Jamie, because we talked about facial PRP earlier, and she says it's extremely painful and she did not notice a change. It worked wonders for family and friends for knees, shoulders, feet, and back issues. So good to know. It's always, you should always talk to somebody that had the procedure first to see.
Well, at least my instinct follows what she also experienced, so I wasn't completely off base. But that's not to say it doesn't work at all or that it doesn't work for some people. I just think the way it's done is very variable. And like I said, I don't really know exactly if we have the proof for it yet.
Yeah. I think we'll do one more question, and then I'm just going to say I've been seeing a lot of topics, so maybe you could write them down, and maybe next time you'll come on a lot of topics on moisturizers. What are the best ones for hands, face? What do they do? Do we need them? And lots of questions on anti-aging. So maybe we can focus on those two general subjects next time. But I would like to get to this question for Deborah, because she's asking for a friend, I think. What can be done for unwanted facial hair?
Unwanted facial hair can be purely cosmetic, and it can be a normal part of being postmenopausal, or it can be a medical condition. So not knowing the context here, I would like to say, if you're a young person and it's not common in your family to have some areas of unwanted facial hair, and it's maybe new for you out of the blue, that's something to have a medical workup about. See your primary care doctor, see your dermatologist. Maybe you end up getting a hormonal workup with an endocrinologist. That's if something seems like it's not right, not normal for your family or for you. If it's something in the normal range, there's only a couple ways to stop the hair from growing. And the reason I say that is that's really the best way to handle it, because anything where we just remove the hair, like waxing or threading or plucking, increases the risk of ingrown hairs and hair bumps and lots of rashes and problems. So to stop the hair from growing, laser hair removal is very effective. If the hairs are not dark.
Yeah, you were going to, because I wanted to do it on my face and they said they couldn't, because you're so right about the endocrinologist. My hypothyroidism was diagnosed by a dermatologist without a blood test when I went in with blonde hair on my face, which is called lanugo. And she knew that it was a sign, and then that referred me to an endocrinologist, but I had to have it waxed because they said that laser, blonde hair would not be amenable to the laser.
Right. Blonde, like I said earlier, lasers need to recognize the darkness of the hair separate, and it can pick up the darkness and use that darkness as a target. Blonde hair and light hair is not seen by the lasers that we have technology for right now. So to remove dark, what we call terminal facial hairs, which are like beard hairs or mustache hairs, they're a little bit stiffer, a little bit darker. Laser, or if they're light colored or white or gray hairs, you might want to do electrolysis, which is where each hair gets its own little individual electrocution. It doesn't hurt, but each hair gets killed with electricity, with a little pulse of electrical energy, rather than the laser light beam trying to target it with a certain color. Dermaplaning is just that very gentle little shaving, scraping of the hairs that's very safe if done carefully. And there's one prescription cream. It's a real prescription. You have to get it from a doctor. It is not covered by insurance, but it shrinks the follicles. So the hairs that are a little thicker and stiffer, they just shrink to become so small that they basically become invisible. It's called Vanica. And it was off the market for many years. It's back on, but you have to use it all the time. It only works while you use it for however many months you use it. And when you stop using it, the hair follicle will regrow to its natural state that it wants to be.
Great. All right. I said last question, but this one I know could be quickly answered, maybe a yes or no. Is expired Retin-A harmful, or is it just less effective?
Well, I'm sure if it's recent, within a year or two, it's just, it may be still as effective. It might not be as well blended. From what I know, if it hasn't been 100 degrees in your house and it's basically been in a safe, cool, dry environment, it probably still works. It may just be less well blended. If it's many years old, I cannot vouch for it not being contaminated or having something wrong with it. So if it's more than a year or two, I would throw it out. That's my unofficial answer. Officially, I could never recommend that you would use anything expired because I just can't vouch for the safety, and neither can the company.
Right. So when in doubt, throw it out, right?
Right.
Isn't it funny that you and I were talking yesterday and I said, there's no questions. You're going to have to do a PowerPoint. We'll have nothing to talk about. And we had a half hour extra of stuff to talk about and still didn't get to the questions on rosacea, anti-aging, and moisturizer, which I hope as soon as we get offline, you'll book with me another time. I'm booking for December now, and you're always welcome to come to the top of the cancellation list, but I know that's hard for you as a working doctor. And also maybe next time, talk a little bit about how people can work with you as a health coach, as well as a board certified dermatologist and lifestyle medicine doctor. You really are one of my favorite people. Your brains, beauty, and just so interesting to talk to.
Oh, Chef AJ, you're one of my favorites. When you made friends with me when you were here visiting New York, it was really a great day in my life because now all this time later, we're still friends and it's been a joy.
Yeah, thank you so much. And thanks all of you for watching another episode of Chef AJ. I don't know my name anymore, Chef AJ Live. Please come back tomorrow at the special time of 3 p.m. Pacific time. I'm doing my Sunday shows a little bit later while I'm in improvisational comedy class. And my guest is Dr. Steve Lewendo. Not Lewendo. I can't talk too much Mexico. Lewendo, Dr. Steve Lewendo, and he's going to be doing an amazing cooking demo. Don't you love it when Dr. Krant? I mean, it shows how multi-talented they are.
Well, I hope that's me one day in the future. Right now, I'm not the cooking doctor, but that's a skill I definitely need to pick up too. So I'll have to tune in.
Yeah, maybe you could do like skin food, like food specifically, that will make your skin beautiful.
That's a great idea. I'll definitely work on that with you. Maybe you're going to give me some tips.
Well, actually, you think of the ingredient, and I'll think of the recipe. We can maybe do a collab, like even if it's just an ebook or a webinar or something.
That sounds amazing. I love it.
I know. I love ideas. I'm so happy to be back. I've done this show live every day since March 20th, 2020, and I missed 6 days with the show. And it was like, I didn't even like missing my own show. I think I'm almost up to 600 now. So thank you so much. And please get back to me right away so we can get you on the schedule for this year. And guys, please come back tomorrow. And I've been posting a link for my free webinar tomorrow at 8:00 if you are struggling to break up with sugar. And sugar is not good for our skin, right, Dr. Krant? It's just not.
Sugar is one of the worst. It actually has very specific ways that it attacks our skin and causes aging and wrinkles.
Great. All right. Take care, everybody. Bye-bye.